Question from the audience, ma'am.
Yes, I have a question about America's competitiveness and how it's influenced by these issues. Art Kelman mentioned GM. I was also thinking about another engine of growth, which is entrepreneurs in America. Most new jobs are generated by entrepreneurs, not by big companies. And usually entrepreneurs cannot offer healthcare because the rates are so prohibitive. So this, in fact, decreases our competitiveness. And this is just one issue, along with the big companies. I mean, globalization is not going to go away. I think it would be a relief to many sectors if healthcare wasn't a drag on their profits.
So your question is?
I'm looking at big business and how it affects globalization.
But you would like to know. But you would kind of like to know.
I would like to know the six panelists' views on how can we possibly keep going forward the way we are if we're status quo when we're going to have huge competition from India, China, and other places that can.
Well, John, I think that's right up your alley, that question.
We already have huge competition from China and India and Europe, these countries with universal care, and by and large, we're cleaning their clocks. America's created 20 million new jobs while Europe created 2 million. So yes, GM has to pay more for health care than steel, and that's awful, but in these other countries, they have to pay huge amounts in taxes, and that's even more crippling.
Point of fact, I think the United States created 23 million jobs when some other guy was president, and has actually employment growth in Europe has been faster since 2000 than the United States. So it's a little bit out of date.
And I would like to add that
Michael Rackless is speaking for the motion.
You think you're cherry picking times? You picked the 20 years. The United States is created
I don't know what that
20-year
period, that 20 million figure refers to. I think that was a number just sort of plucked out of air.
Okay, let's stop there. We're getting a bit off topic. Michael Rackless.
Yeah, that in all this talk about healthcare with traditional economic models, that is one of the main reasons why you folks have not been able to make progress, is using traditional marketplace models focused on that as your ideology to analyze healthcare, which is not in any way close to being a traditional economic market, and to apply some sort of economic language, the way we're hearing from the other side, to a system which is where the supply side is massively regulated for good reasons. You know, do you want to be able to, you're going to have to look up every single provider that you see to find out, whether or not they pass their licensing exams or not? Now, the extension of this argument would be Milton Friedman's one, that just absolutely no regulation whatsoever. But that doesn't deal with healthcare, where it, by and large, for key decisions, consumers can never be at the same information level as the agent who's recommending those services.
Sally, perhaps you look like you're dying to say something.
Dying to say that, we got a lot of the mess that we're in this country, including part of the 46 million, is because the federal government gave employers a tax advantage to provide health insurance. And as a result, people in America, 60% of people in America get their health insurance through their employer. If you lose your job or you quit your job, we don't have portable health insurance. If we make a few simple tax changes, such as refundable tax credits or an income tax deduction, we really need to focus on growing the individual market so that people can buy insurance across state lines, people can get the type of insurance that fits their needs. We can grow the individual insurance market because competition will work. And when we have 1,900 mandates on insurance across this country, it's impossible for an insurer to provide a stripped-down policy, which two-thirds of the uninsured are in that 18 to 30 age bracket, and they don't want to buy insurance with, as John said, in vitro fertilization, alcohol rehabilitation. We can open up this market and cover a lot of those people. Because of the 46 million uninsured, 17 million earn over $50,000 a year, and 10 million earn over $75,000. A lot are young, they're healthy, and they don't want to pay $4,000 a year for insurance to cover things that they don't need to care for.
Thank you, Sally Pipes. Question down
Many
front,
of those
please.
folks have illnesses, and they cannot get insurance no matter how much money they pay.
The market, new competitors would come into the market, and some would, and they would be based on competition.
Healthcare is not a market like other markets.
Well, it's
but
not
it's
a
not
right.
even
It's
close
not a
to being
right.
a market like other markets.
Time out. Too many people talking at once is not making sense. Michael, go ahead. And Michael Cannon speaking against the motion.
Healthcare presents a lot of interesting challenges, and the question is not, oh, well, it's special, so therefore markets can't do it. The question is, well, you know, markets and government have advantages and disadvantages, and which one works best? Which set of tools works best for this particular problem? I've always enjoyed hearing from proponents of universal coverage that the U.S. has this market-driven, for-profit healthcare sector. You know, the government controls half of the money in our healthcare sector. And because of government tax policy, employers control another quarter of it. So 75% of the money is controlled by someone other than the consumer. How, in any way, is that a free market? I'm reminded of a favorite expression of my brother's. He likes to say, you know, you're pissing on my shoes and telling me that it's raining. What's driving these costs and what's driving these quality problems are those 75%. So, well, I'll stop there.
Thank you. Question down front.
I have a quick question for Dr. Kellerman. You mentioned the Mayo Clinic as a model of efficiency, and I think we all recognize it as a model of great health care. What's the impediment right now to having more Mayo Clinics in this country? Why don't we have them if the market can provide that? And I don't know that we could look anywhere. People come all over the world to the Mayo Clinic. Why doesn't universal health care coverage provide that in other places?
The Mayo Clinic has a great philosophy. It's very heavily focused on primary care. They're very heavily focused on efficiency. You don't have to be efficient to be successful in this country. I just have to talk you into getting all the tests that I want you to get. I need to talk you into getting the procedures you want. You know, we just talked about economics. Everybody these days is complaining about gas prices with good reason. But if we ran our oil industry the way we're running our healthcare industry, gasoline would cost $16 a gallon, and 1 out of every 6 American cars couldn't burn it. We can do better than that.
Question from the back there.
My name is Tony Meyer, and I care about this issue too. And in 2002, I founded a company that today is one of the largest managers of defined contribution programs for corporate America. And we work with General Motors and Ford and Chrysler and many other great American industrial companies.
This had better be a question and not a commercial.
There is. This is not an advertisement. My question, and Ms. Pipes, you just mentioned it, no one has talked about the fact that we have a unique healthcare delivery system which is really managed by large employers. It's unique in the world. Nobody's talked about whether that's a problem or a solution. Should it be reformed, discarded, modified? I'd be curious what the panel thinks of that approach.
I mean, if your employer is paying about $15,000 for your health coverage, you know, that might not be the kind of health coverage that fits you as an individual. You may not want that type. But if we open up the market and give individuals the same tax incentive, because if you go out in the individual market and buy insurance, you don't get a tax break on that. But if you get it in decreased wages, but through your employer, it's cheaper and you're able to get it because you're part of that pool. So we need to, as John says, actually discard that model and move away from it. You know, we can't move away from it overnight, but we can make some changes in the tax code that will allow the individual market to grow. And we don't get our life insurance, we don't get our long-term care insurance, our home insurance from our employer. As I said, this was a gift during World War II, and it was a terrible gift that has distorted, in my mind, a great deal of the healthcare system.
Paul Krugman.
Yeah, it's not the system you would design if you were starting from scratch, and it's not the system we want to end up with, but it's a system that at least did the basics of risk pooling for a lot of people. It's a system that did deal with the problems of pre-existing conditions and people being screened, and it does somewhat reduce the problem of insurance companies competing not to deliver care, but to who can do the best job of finding who really needs insurance so as not to give it to them. So it's not, I have no brief for that system, but the idea that what we need to do is scrap it and move to an individual insurance market, which has never worked anywhere. It's the most amazing thing that what we have coming from the conservative side is the belief that universal health care, which works all across the world, is undoable. And an individual market, which has never worked anywhere, is the answer to our problems. Extraordinary leap of faith.
Are you familiar with Professor Pauly's research on the individual market?
Yeah, I've seen some, but you know, there just isn't enough.
You've seen some. That's where reality enters the discussion.
Time is up for this section.
Hey, it's Rebecca again. You found my second video. Great. So hopefully right now you're looking at the big picture. The big picture is all these folks have to buy health insurance, right? And if they don't buy it, they're going to get a little slap on the wrist. Ouch. Maybe a little bit more. They're going to get a penalty, and we're going to talk about that. I want to spend a little bit more time on these key terms. Open enrollment. Right now, you can be selling policies to all your folks, and I highly encourage you to be writing them a major medical, fully underwritten policy now, because there are carriers out there that are guaranteeing those health rates until December 2014. Call me, I'll tell you who that is. I'm not allowed to say it. Their legal team will come and hunt me down and shoot me. So just call me. But what's important about that is that this first year of reform, right, this first year will be insane. I really don't think the federal government will have all of the exchanges set up in these different states. I don't think all the states will be ready. There's too much uncertainty. Heck, half the people haven't even gotten through the entire bill. So with that being said, there will be so much confusion this first year if you can write your client a major medical policy now. And it's going to be fully underwritten, so they have to qualify. And you're going to lock in that beautiful rate of like $200, $300, and it won't change until December 2014, buying you an extra year of time to just see what happens. What's going on? You'll be a genius. A, you're going to make your clients super happy, because as soon as they get that renewal, come 2014, say next January, next February, they are going to have a heart attack. Everybody thinks this is affordable health care. There's nothing affordable about it. You can guarantee that rates will increase a minimum of 50%. A minimum of 50%. A good way to check out projected premiums, go to our website, gordonmarketing.com. Our link is right here. Go to the medical site, and I have a health reform page. On that health reform page is a subsidy calculator. You can plug in ages, you can plug in incomes, and it's going to give you a projected amount. If you're smart and you're reviewing your current block of business, you're going to have a projected, right, reform rate and compare it to an existing, we'll say an Assurant major medical rate, okay? You're going to show the client the difference. If you're smart, you're going to lock them in and keep those rates so that a year from now, we're going to be a heck of a lot smarter. We're going to know more options. We're going to know more things. That is open enrollment. Guaranteed issue. The way now that insurance companies can rate your clients is this way. A, we can rate them on their geographic location. Where do they live? So obviously people who live in, say, New York City are going to pay more than people who live in Noblesville, Indiana. Smokers. Good time to quit smoking is now, because they are going to ding you 50%. So where you live, if you're a tobacco user, your age, and then how many people are in your household. That's it. Everybody else, all the diabetics, all the hearts, all the people who are really overweight, blood pressure, Paxil, whatever else, guaranteed issue. Keep in mind, with all these new health reform plans, the essential health benefits are included automatically. And if you're not familiar with those, check out my website on the reform page. Also, the 3-to-1 rating is now going to be with every policy. So instead of a 5-to-1 ratio, it's a 3-to-1 ratio. And then the third thing, of course, is that it's guaranteed issue. So if anybody asks you, why did rates just go up? That's why. All right, exchange and marketplace. Again, this is a website. Every state has to have an exchange. Either the state is going to run the exchange or marketplace, or the federal government is. No state can opt out. Everybody has to have it. There's only one reason a consumer is going to go to the marketplace to buy a policy. Tax subsidy. That's the only reason. Money. That's it. If they think they can qualify for a tax subsidy, they're going to the exchange. Do you know that the exchange or the marketplace application, from what I'm hearing, is 21 pages? Did you know that before a consumer can ever get a rate on the marketplace, they're going to have to answer 35 questions per person? How many of your customers are going to want to do that? Probably not too many. Certification. Again, if you're going to play in the exchange, in the marketplace, if you want to be a licensed agent and capitalize on this business, great. You have to be certified with every carrier in that exchange. So let's take the great state of Indiana. Let's say I have 10 players in the exchange. And I'm a licensed agent, and I want to be able to make an override, make some money off of any of my customers I put in the exchange. That's great. But I have to be certified with all 10 carriers. I don't know what the certifications look like right now. I would suspect come June we're going to have more information. But keep this in mind. We have been market leaders, industry leaders in the Medicare Advantage circle. Number one FMO with WellPoint, number one FMO with United Healthcare. We've been doing this for years. So we know this business. We know this lingo certification. That's why you want to team up with us. We're going to walk you through it. We're going to make sure you stay compliant. We're going to make sure we all stay out of trouble and that we make money while doing that. If you're going to sell in the private sector outside of the exchange, remember, the only reason you would buy in the exchange is for the tax subsidy. So if your customers are going to buy outside of the exchange, you don't have to be certified. Lots of confusion, lots of things to keep in line, to understand. My advice to you, write it all down. Keep writing it down, keep committing it, tune into my webinars. Tune into my webinars. I will help get you to the level you need to. Look for my next video for more information.